Her BP was 70, systolic initially. Her SATs are pretty poor and her heart rate's up, so everything's wrong with her.
It's a critically injured driver.
She's been involved in a really bad car accident and been trapped for some time.
Sounds like trouble.
Yes.
Femur, pelvis, right and left hip fib.
Yes.
Whenever people have a blood pressure of 70, which is about half of what it should be, and a heart rate of 120 or 130, which is about double what it should be, there's a high chance that they'll die and they won't make it.
The 28-year-old was trapped in her vehicle for an hour, taking most of the high-speed impact to her lower body.
All right, guys, patient is here.
All right.
Hi, guys, welcome. I'm Michelle, team leading.
Yeah, I'm Lee. This is Eloise.
From what we've been told, anything and everything could be wrong with her. We have to prepare ourselves for the worst.
I'll take the legs.
1, 2, 3.
This is Eloise, the sole occupant driver of a small car involved in a head-on with a truck who's come across a median strip on the opposite side of the road in a 100km/h zone. Significant impact, clearing fractured pelvis. Her legs were shortened and rotated upon extrication out of the car with significant pain.
When somebody's leg's shorter compared to the other leg and the foot is pointing outwards instead of forward, it's a pretty good indication that they've broken a bone, usually in the hip or in the thigh. The bones overlap and causes one leg to be shorter than the other. Somebody check the first unit of blood and put up, please. We know that she's critically ill. She's likely broken her leg. She's bleeding from somewhere. It's just a matter of prioritizing what needs to be done first.
There's no fluid in the right upper quadrant.
None in the right, good.
We're doing an ultrasound to have a look at the internal organs to see whether there's blood in the wrong place.
She's got free fluid in the pelvis. Yeah, tons of fluid in the pelvis.
It's positive. Boom. We need to be in the operating theatre. She's got internal bleeding.
She looks terrible. She looks shocked.
Now I know what the big risk is to her life.
Emergency Dr. George Plunkett has been part of the Royal Melbourne team for 15 years, having started at the hospital as an intern.
There's a lot of satisfaction that comes from being involved in some of a person's most important moments in their lives.
Morning, Abby.
Morning, how are you?
Well,
And to potentially intervene and make a positive impact.
ready for another day?
It's not long before Dr. George is needed in the ED, with a serious trauma arriving. A truck driver on his way to work has just survived a terrifying ordeal.
Get him across.
Read through that medicine for me, yeah? Amen. Amen. Look at me. Amen. Open your eyes.
This is Ahmed. It looks like he's gone into the back of another vehicle about 7:20 this morning with significant damage to the front of his cabin, crushed all down one side, steering wheel into his pelvic region and significantly pinned on the left leg with the pedals and the dashboard. In regards to injuries, we have identified he's got most significant being the left lower leg open major compound.
The father of three's leg is a mangled mess and may be beyond repair.
Essentially amputated. We all can't imagine what Ahmed's been through. I'm sure he's aware that he's got a leg that's pretty much severed and he's probably thinking, will I ever be able to walk? Will I be able to run around and play with my kids? And I imagine that's an awful lot for him to be processing at the moment.
It took 2 tourniquets applied by paramedics to stop Ahmed bleeding to death.
I'm not sure what to make of, is this one for plastics vascular input at this stage? We'll get ortho to come down and have a look first. They may want to see what's going on with some of these tourniquets.
Dr. George believes Ahmed owes his life to paramedics, who managed to get him out of his truck despite his leg being horribly trapped.
If it can look chaotic in the emergency department, it looks even more chaotic in the pre-hospital environment. You're trying to treat a guy in the front cabin of a truck that's wedged against another truck, and you can't even see what the injuries are.
Yeah, you should walk kindly. Sorry, you're hurting.
If we lifted his leg up at the knee, the lower part of his leg would still be on the bed. There's no bone connecting the two spans. This leg is essentially just being held on by some muscle and skin at the back end. So it's absolutely feasible that this could end in amputation.
Well, let's try and make her respond. She's not really that responsive.
In Trauma 1, a terrible accident has nearly cost Eloise her life. She has multiple broken bones and internal injuries. Dr. Michelle and Dr. Jonathan are not sure she'll make it.
She certainly looks shocked.
It's a really precarious situation. She's still critically unwell. It's touch and go.
Okay, she's feeling nauseated. Did she get that Maxilon?
She has injuries to her leg.
First blood pressure was in the 80s. It's reading now and going pretty low.
We also fear that she has internal injuries to her organs, bleeding from somewhere, maybe the bowel or her spleen or her liver, and we won't know for sure until she has surgery.
She could be bleeding from multiple places.
The 28-year-old's internal bleeding has put her into shock. The team must get her to theatre.
Maybe we'll step that up into a RIC line. Let's do that.
A RIC line is a rapid infusion catheter. It's a way of giving blood really quickly.
I've got a RIC.
We want to resuscitate Eloise as well as we can, and that RIC line will enable us to do it. We fill her up with blood so that we can overcome the shock.
With the young nursing student's life in danger, Dr. Michelle calls Eloise's mum.
Hi, Donna. I'm calling about Eloise. Is that your daughter? Yes, she has. Did you get a call from someone?
It's really difficult, no matter how many times you do it, to call a family member to let them know that their loved one is in hospital and has been in a horrific accident.
She's okay in terms of she's alive.
I want her mother to be able to come to hospital and get here safely and not be overly distracted or worried as she's driving in.
So take your time. Don't rush in here. We want you to get here safely.
I could feel what she's going through. I too have a daughter and worry about her all the time.
Okay, welcome. Bye-bye. Bye. Wow. So that was her mom who heard, I think, on the news that there's been a bad accident. And she heard the helicopters, tried to contact her daughter and didn't get an answer, and she had a sinking feeling in her stomach. Mother's intuition, I guess.
It was the call Eloise's mum, Donna, was dreading.
I knew myself that she'd been in an accident, that gut feeling. But then when the doctor started telling me she's got quite severe injuries, that's when it really hit me and I just fell to pieces.
I am determined to look after her daughter and do the best I can for her.
Down the corridor, Senior Emergency Dr. Maya Cubitt is treating patients who've managed to get here under their own steam.
An emergency department is an open door, 24 hours of the day, for whatever it is that the public has decided is their urgent need. And they're often a little bit scared, they often can't find anywhere else to go.
Right, I'm going to see a patient.
20-year-old student Jessica has debilitating pelvic pain and a tightness in her chest.
So my name is Maya. I'm one of the doctors. Jessica, what's happened? You've just got your mask folded up on your face.
Sorry.
It'll just make your face a bit sore. Let's fix that. There you are. How can I help?
So I've had very intense stomach pains for about 3 days now. Wednesday, I went to the bathroom and I was bleeding, but I was like, okay, I've got my period, and then I got very, very intense pains. Thursday, I got sent home from work.
For tummy pain?
Couldn't even stand up properly.
Yeah.
She's very, very sore, and I'm just in a lot of pain.
And are you still bleeding?
No.
Okay, all right. And any chance that you're pregnant?
No.
Okay.
On the way over, I had very intense chest pains.
Okay, lie back and let's have a look at your tummy.
Women's pelvic pain often drives other symptoms alongside it, and my job is to figure out what's going on and to make sure there's nothing serious underlying it.
Have you had tummy pain before, or is this a new thing for you?
I've always had period issues. This does feel a bit different though. And I've never had it 3 days straight where like I can't walk.
Yeah. All right, let's have a look. Where is it sore?
Like here.
Okay, so you're now breathing a bit fast, so you need to slow it down.
Sorry, I'm just a bit sore.
It's all right.
Pelvic pain exists in an area of a woman's body that might lead us to a more serious cause, but Jess's abdominal examination is relatively reassuring, although she's still in quite a lot of pain.
You seem a little bit extra worried today, maybe a little bit more than I might have expected. Is there anything else that I'm missing?
I just have really bad chest pain.
Yeah.
And my mum died from that. So
when did your mum die? Tell me about that.
18 months ago.
Okay. How old was your mum when she died?
52.
That's horrible. And you know what? It all makes a little bit more sense to me now, and I'm really grateful that you told me that.
Sorry, I don't normally cry about this.
You're allowed to cry about all those things. That sucks.
Oh, it does. My auntie died not that long ago, so like 2 weeks ago.
How old was your auntie?
She was like 58 or something.
Yeah. Shit times, huh?
I was having a shitty year.
A really shitty year. Yeah.
I just really want my mum right now.
Yeah, I would want my mum too, honey. I understand why you're feeling really upset about all this.
It's pretty clear that there is more going on here for Jess than just physical pain, and sometimes the most important thing we can do in medicine is to listen, acknowledge that, and give her a chance to feel that that's just as validated and just as important to us as it is to her.
I'm just really sore and I just want a hug from her, you know.
Oh, I'm so sorry that I can't be your mum.
No, that's okay, I'm sorry.
No, you're allowed to have a weep. You're making me cry though. We're all gonna sit here and have a weep, aren't we?
Jess is having a really tough time. What she's saying is, I usually manage this with my mum. My mum is usually here to help understand, to help advocate for me, and to make me feel better.
Sorry.
Over in Trauma 2, truck driver Ahmed has been smashed up in a collision which may cost him his leg.
Yeah, we know the leg is sore.
This is a mangled limb, and I don't know if this is going to be salvageable. It's possible the leg might end up amputated.
We'll get some x-rays and see what's left to work with. Got a couple of tourniquets on that limb to help settle the bleeding down. His pelvis looked fine, but his lower leg essentially looks as though there's almost like the skin and the muscles really the only thing holding his leg together. The bone's just been kind of smashed to bits.
What happened to Ahmed today could change his life. Not only does he have a demolition business to run, he has a wife, Lorraine, and 3 young children to support.
The thought of losing Ahmed, it's sickening to me. I don't know what I would do. He is the world, not only to me, but to my children as well. He's kind, generous, you know, all the things you want in a person.
So the next thing from here will be getting CTs, see if we can work out what can be done to fix this leg up as best we can.
While waiting for CT, Dr. George and orthopaedic specialists are weighing up when to take off the tourniquets that are still on Ahmed's leg.
So they've initially put an upper leg tourniquet on at 8 a.m. That was while he was still in the truck because they had no idea. They actually thought the leg was off. Yeah. They've then got him extricated and had quite a bit of blood loss, so then they put a lower tourniquet on at 8:20. Yeah.
The tourniquets stopped Ahmed bleeding to death, but at some stage, they have to come off.
I'm just a little bit nervy about taking tourniquets down now, pre-CT, to then have to put them back on.
Yep.
Yeah.
Scan him, and then we'll know.
If you leave the tourniquet on for too long, then that lack of blood flow kills off the limb as well.
Any of these lines open and working?
There's no hard and fast rule when the tourniquet should come off. Dr. George decides it's safer to leave them on for now.
At what point will we release the tourniquet?
I'm thinking after CT. I'm just really nervous about...
CT?
Oh, no. In theatre.
In theatre.
On the one hand, I do want to keep the tourniquets on as long as possible because I fear that if we remove them, we could have an uncontrolled bleeding event. The way I'm thinking about it is simply, you won't get the perfect answer, and we've got a stable, you know, house on fire at the moment. Let's get CT as soon as possible.
While Ahmed's leg is put in plaster to stabilise it for CT, a call comes down to the ED, changing Dr. George's plans about the tourniquets.
Vascular's coming down. They would like to take the tourniquet off before we go in there. They're going to be here in 2 minutes.
Ah, really? We're trying to wheel to CT right now.
Yep.
They want it off?
Yeah.
He's got a leg that is flapping about in the breeze. Yep. I'm kind of trying to do less is more at this stage to try and not make any bleeder squirt. Okay. That moment that we take the tourniquet off, what then? Will it become unstable? If it does become unstable, yeah, that becomes a life and death situation, but we'll just have to wait and see.
Are you sore in the tummy?
No.
No, it's not sore. It looks like you've got a lot of bleeding in there.
In Trauma 1, nursing student Eloise is in a critical condition after her small car and a truck collided.
Look, the leg's short. See, it's short.
Yeah.
So why not a dislocated hip?
Very possible, so we'll see on the x-ray.
Dr. Michelle and Dr. Jonathan believe she's bleeding internally as a result of the severe injuries to her lower body.
Just palpate all the...
Can't feel a definite step.
Good, all right.
It is a precarious situation. She has lost a lot of blood, and at any time she could have an arrest because of this blood loss. So it's really important we identify the necessary injuries quickly and treat her as quickly as possible.
All right, are we ready for x-ray? All right, are you almost ready?
It's possible the bleeding is from a broken pelvis or hip, a very serious injury for the 28-year-old who's hoping to start a physically demanding career as a nurse.
It's really difficult to know if she'll be able to get back into nursing. It may not be exactly the way she had dreamed or planned.
The whole pelvis looks off to the side on the right, so whether it's the hip or whether it's...
In the joint. Okay, guys, so there's no obvious dislocation of the hip. We just leave the binder inside you, and we need to get her ready for transport. We're going to be going to theatre.
While Eloise's hip isn't dislocated, the X-ray has confirmed it's broken. But it's internal bleeding that's threatening her life.
We're going to take you to the operating theatre because you're bleeding internally, all right? We're just going to have a look and fix that. And you've got a broken hip, that's why it hurts so much, all right?
Eloise's mum is still on her way, but the team can't wait. They've got to get her to theatre.
She might be bleeding from a liver or a spleen because there's something bleeding there.
If the bleeding isn't stopped, Eloise is in grave danger.
She may well bleed to death.
All right, we're going to theatre.
All right, thanks, guys.
Let's take the blood. We might need that.
What was your mum's name? It was Vicky. Vicky.
Down the corridor, emergency Dr. Maya Kubert is treating 20-year-old Jessica for severe pelvic and chest pain.
How old were you when she died?
I was 18.
Shit house,
It was like pre-COVID.
Yeah. Were you with her when she died? Yeah.
Yeah. That's why I feel bad for my dad, because I feel like I just really freaked him out in the car.
With your chest pain? Yeah, you probably did freak him out, but that's okay.
Jessica is really distressed, and her distress is manifesting in lots of ways, and sometimes that includes other symptoms like chest pain.
Pain and how we manage pain is a lot to do with how we're feeling. And when I'm really tired and I'm really sad, everything gets worse.
The symptoms are real, but getting to the bottom of what's driving them is a little bit harder.
So Jessica's come in with bad period pain, which she's had before, that she used to manage with her mum, who died. She lost her mum, and a few weeks ago her aunt, and I think she's struggling with how to manage that. Oh, I'm feeling a bit tearful, actually. I was thinking about my daughter, that poor young woman. And then she had what sounds like a panic attack on the way in, and she's just in a little bit of a mess. She's a bit sad. So the blood tests are all normal. Jessica, I've got a spot to pop you in where we can try and get on top of your pain a little bit more, and I can bring your dad in if you want.
Yeah, thank you.
All the blood tests look fine.
Yep.
Okay?
That's good.
Coming round here, okay? We might even be able to find a heat pack. What do you reckon?
We all have someone that has helped us get through things, and when that person is missing, when we go through that again, it's really hard not only to manage that day, but also to manage the grief.
Liana, this is Jessica.
Hi, Jess.
She could do with a hug and a heat pack.
Absolutely.
Okay.
I can manage that.
All right.
Thanks.
I'm going to get you a blanket.
Thank you. I'll get it. No worries.
Oh, thanks,
Yeah,
Liana.
absolutely.
Appreciate it. Thank you. Mostly what she needs is some care and empathy and a hug and feeling like she's okay and that she's got people around her that can reassure her and make her feel like she's safe. Thanks. Sometimes that's all an emergency department is. It's a safe place with people who care, who can reassure you that you're okay. And that's enough to need to be here some days.
Just going to see a guy now. One of the nice things about working in emergency is the characters that you meet, and you never quite know who's going to walk through the front door.
Emergency Dr. Michael Dunn's next patient is 81-year-old Kevin, who's somehow hobbled in with excruciating leg pain.
Hello, sir. I'm Michael, I'm the doctor. Now, give you a hand with these. Which leg is hurting you? The left leg, okay. Kevin's had a collapse at home and somehow come into ED by a bus, and despite having a pretty serious leg injury, he's managed to limp his way all the way to the ED. What's been going on?
Last week, I just fainted.
You fainted?
Yeah. I fell on the floor and I was out for about 2 minutes, something like that. And then got on the bed and I didn't move till Wednesday.
When did this happen?
On the Monday.
So for 2 days you stayed in bed?
Yeah.
Was that because the leg was too sore?
I was still...
Still dizzy?
Yeah.
Okay. So my biggest concern for Kevin isn't actually his leg, but the dizzy spell that he had that brought him in, which to me is a little bit more serious. So what caused you to collapse? Did you feel lightheaded? Did you feel weak before?
I was just pushing a TV from the bedroom into the lounge.
Yeah.
And then I just...
No warning whatsoever, just collapsed. There's a few reasons as to why he may feel dizzy, and some of those things can be quite serious. When you woke up, did you know where you were?
Yeah, I was on the floor.
And did you have any pain in the chest or no? Any breathing problems?
No.
Any headaches?
Not really, but the head was sore.
You were spinning after that, were you? So you felt perfect before you fell, and then suddenly you just dropped.
Almost perfect.
Almost perfect, yeah. And then what happened on Wednesday?
I got up because I had to go out and get some food.
How did you get food? Did you walk?
Yeah.
And the shops are nearby, are they?
No, well, half an hour.
You walked half an hour?
Yeah.
That's pretty good. Somehow Kevin's been managing it around with that injured leg for the last week. I don't know how he's managed to do that, but just some people have different pain thresholds. The worry is if somebody is avoiding seeing a doctor, if something serious has happened, is that some of these conditions are more time critical than others. Do you mind if I have a look? Just here, is it?
Yeah, they're all over there.
Is that sore?
Yeah.
In there is sore?
Ticklish.
Ticklish, okay.
The former bar manager lives alone.
We are seeing a lot of elderly patients who don't have the supports that you ideally would want in place. Like there's innumerable patients that I've seen whose neighbours have found them on the floor, and that's the reason they made it to hospital in time to be treated. I know you're worried about the leg,
Yeah.
but I think this I'm less concerned about, given the fact you're walking half an hour. But the collapse is a bit unusual. It came out of nowhere. There's no warning.
No.
Right now, we're going to arrange a scan for Kevin's leg, a scan of his head too. But my big concern is these collapses. If he went home and happened again, could be potentially fatal.
So apparently vascular want to come down desperately, get the tourniquets off in the next minute.
In trauma 2, 31-year-old father of 3 Ahmed may still lose his leg, which was partially amputated in a truck accident.
All right, we're going to roll you to the side now. 1, 2, 3.
There you are, with plenty. It's absolutely undeniable for Ahmed that these injuries are life-changing. It'll change the way he works, when he can get back to work, if he can get back to work. This will have ongoing health impacts ranging across multiple organ systems for the rest of his life. Vascular, I really want to get this guy up to CT. I just need to crack on.
Vascular surgeons want to take off the 2 tourniquets on Ahmed's leg before he goes to CT. The longer they stay on, the more likely they'll do damage to the blood vessels. But Dr. George is worried about uncontrolled bleeding.
Needed to be in CT 15 minutes ago. It's that whole thing, the tourniquet versus the tourniquet on versus off. The tourniquets need to come off at some stage. But I think everybody involved in the case is very cognizant there is no one answer to this. Personally, I want to take them off at the last possible safe moment that we can.
I'll attend such that if there's any...
Beautiful. Great, I like that answer. Excellent, thank you. The negotiated position we've been able to reach is that we'll pull the tourniquets off with the vascular team staying with me, with the patient, and with theatre available, so that if he does start bleeding, I have the correct surgeon in the room to control that bleeding straight away.
The tourniquets are taken off the moment Ahmed is off to CT.
Tourniquet's off. Pulse remains 84. Doing really well, my friend. Awesome. The tourniquets come off, things are going well. That's amazingly satisfying.
All right, assuming we don't develop instability, I'd be happy for him to go to CT like this.
He's going to go to CT level 1.
Sandra, let's go.
While Ahmed is being scanned, it's a nervous wait for Dr. George with a patient this unstable. The CT rules out any life-threatening injuries.
Well done. Just grabbing a little bit more ketamine.
And while his leg is shattered, doctors discover there is blood flow.
He's still got some of his arteries undamaged, and they're providing blood flow beyond the site of the injury. His foot, for instance, it's still potentially salvageable. Ready, set, go. Ready, set, go. You're doing so well.
Ahmed is on his way to surgery, but with no certainty his leg can be saved.
Even if we do everything right, things still mightn't go to plan. This is going to be, at the best case scenario, multiple operations, months of hard work for multiple surgical teams, rehab teams, and for Ahmed himself and his family to try and get things, working for him. This isn't going to be a sprint race. This is an absolute marathon.
All right, so what we'll do is we'll take the trousers down, put the gown on, and I'll have a proper look at the hip and the leg.
Down the corridor, Dr. Michael is examining 81-year-old former bar manager Kevin, who has severe leg pain after collapsing at home 11 days ago.
I think you might potentially have done some damage here to the bone.
Yeah.
You might have broken that, but we'll get an x-ray just to be sure, okay?
Okay.
But then I want to do also a scan of your head and look at the heart and make sure that's okay.
Okay.
All right. So after Kevin's collapse and leg injury, we're doing some tests, but we're going to examine him head to toe as well to see if there's any other signs as to why he collapsed. All right, we'll change the trousers.
Got the music going?
The music going?
Yeah, tricky.
You can leave the hat on, isn't that right? Unfortunately, don't have the stripper music that he requested available, but it's nice to see Kevin relax despite what potentially may be something serious causing his fall. He seems to be taking it in his stride. I want you to follow my finger, and if you tell me if you get any double vision, okay? C1, yeah? Good. Now, I might have a little listen to the heart, make sure it's okay. So there's multiple reasons why someone could unexpectedly collapse, ranging from heart problems to problem with the brain, like seizures or bleeding. And that's what we're looking for in Kevin. Is there an explanation as to why he's had these dizzy spells?
I just have a little
dizziness now?
not dizziness, but it's
Lightheaded?
yeah.
That's okay. We'll get you on the monitor and we'll get some tests and just try and figure out what's going on, okay? Okay, all right, I'll come back to you.
How long is it going to take?
Because you're at home alone and because you had this collapse, I think regardless of what the tests show, there's a good chance you'll be staying with us overnight. All right? Okay, come on. Okay, pull Slayer. The fact that Kevin's still having dizzy spells in the ED, he needs to stay in hospital. It's too dangerous for Kevin to go home.
Hi, team. Oh, the positive salt and vinegar chip sign. That's good.
In the Royal Melbourne Emergency Department, Dr. Meyer is treating 20-year-old student Jessica, whose worried dad Shane is now with her. With the blood tests normal, it's likely Jessica's chest pain is a result of a panic attack, but she's still suffering extreme pelvic pain.
What I've done is I've made a referral to one of the gynecologists, and we need to get on top of it.
She's in a lot of pain. That really does suggest that she's got underlying endometriosis.
I don't think at the moment anyone's got a magic wand for this, and I think you've done this before, and I know that you can do it again. It's just painful and a slog, and it's an unlucky part of being your... Yeah. I wasn't going to say it. Yeah. If you feel like things are manageable, you could go to your own bed at home. If you feel like things are not manageable, you can stay with me. It's worthwhile considering the options.
I'm sore, but I'd rather give someone a bed who needs it.
Okay. She's an altruistic lady.
Sweetheart. Sweetheart.
We've empowered her, hopefully, to try to manage care herself into the future. That's a satisfying day for me, even though one might argue I haven't done very much.
All right. Thank you for your help.
No problem.
Thank you very much. It was nice.
It's lovely to meet you both.
Thank you.
No props, guys.
He's quite tender over the femur on the lateral side. He's probably got fibular fracture. So we're going to get an x-ray of his fibula. We'll get an x-ray of his chest. We'll get a scan of his head because he lost consciousness. But I think ECG is the most important.
11 days ago, former bar manager Kevin lost consciousness while moving his TV and now has a suspected broken leg.
Kevin, breathe in for me.
Dr. Michael is also running a series of tests to find out if he has any serious underlying medical condition that caused his fall.
Breathe normally.
The x-ray looks okay, but I still suspect that there's a crack there in Kevin's leg. And the CT scan's pretty good. There's no signs of bleeding, but what I'm most worried about is his heart. So we need to get that tracing of his heart to make sure it's okay.
Just had your x-ray.
While Kevin waits for his results, he's still trying to remain positive with his trademark sense of humour.
I walked from Kensington to Carlton the other day, but I had to get public transport back because I do a pub crawl on the way.
A pub crawl on the way?
Oh, yeah. Sometimes I might go to about 12 pubs.
Big day.
Hey.
How can we help?
I have a guy in 14 that probably needs some cardiac monitoring. He's just got trifascicular block. The machine doesn't think it's first degree, but it looks first degree.
Dr. Michael receives Kevin's ECG results.
Hello. Hello. So, we did a tracing of your heart. And there's the top part of the heart that talks to the bottom part of the heart. And I think the time you passed out, there was a disconnect and your heart wasn't talking to itself.
Oh.
Now...
Had an argument.
I had an argument, exactly, yeah. Now, those arguments make you pass out. there may be some problems with the nerves that tell the heart when to beat. And the worry is that the heart just stops working.
So in order to stop it happening in the future, because sometimes it can happen and not get better.
A heart transplant?
No, not a heart transplant. But you might need a pacemaker. When your heart decides to have another argument, that takes over and keeps you from passing out.
And it helps me to walk faster.
I'm not sure about that. Not sure about that.
A pacemaker in the right patient is a fantastic option. So Kevin's going to need a time with cardiology, and they're going to monitor his heart and really decide, is he at that threshold where we need to put a pacemaker in now, or can we hold off a bit longer?
We'll keep you in hospital, we'll get that sorted for you. But it's good news you came in today, because if you hadn't come in and this happened at home and no one was around, could have been...
Goodbye, Taylor.
Could have been, yeah. Your hurt leg probably saved your life.
I'll have to congratulate you.
You will, yeah.
Have a party for it.
Yeah, exactly. Do you want me to call anyone? Let them know you're here.
Actually, you could call the John Coden Hotel.
Yeah?
Rusty, the licensee.
Yeah.
I was supposed to have a drink with him tomorrow afternoon. So you can tell him that I won't be there.
Just yet, yeah. Get a pacemaker and then have a drink.
Yeah.
I think he's as tough as nails, and that's obviously a different generation. They, don't come to the doctor unless it's serious. So, but yeah, he's a nice guy, and we just need to make sure it doesn't happen again to him. Hi there. I'm hoping to speak with Rusty if he's available.
First time I've had a drinking buddy as a point of contact, but anything to help.
Would you let him know that Kevin will have to cancel they're meant to meet tomorrow, but he's not going to be able to make it? Cool. Thank you. Yeah. Cool. Thank you. Thanks, buddy.
She's got free fluid in the pelvis, tons of fluid in the pelvis.
28-year-old nursing student Eloise was critically injured when a truck ploughed into her car.
She looks terrible. She looks shocked.
She could be bleeding from multiple places.
Dr. Michelle and Dr. Jonathan were worried she may bleed to death from her internal injuries.
I'm calling about Eloise. Is that your daughter?
I still don't know how I survived. And other people have been in much less serious situations and they don't survive.
Doctors found that Eloise had a ruptured spleen, as well as bleeding lungs, fractures in her back, her right leg, and both her feet.
Look at them.
They're so good this year.
Aren't they?
Look at that.
Beautiful ones.
It's been a long, tough road. But after 8 weeks in hospital and several operations, Eloise is back at home being looked after by her mum.
We're so happy that she's back. She's in our arms, we can cuddle her again.
Eloise is determined to make a full recovery and to complete her nursing training.
My dream is to go back to nursing full-time, live how I was. No walking issues, no mobility issues, having no surgeries, just a pain-free future. So I can help other people who are in the same situation that I was in.
I've had very intense stomach pains for about 3 days now.
20-year-old Jessica came to the emergency department with tightness in her chest and debilitating pelvic pain.
Is there anything else that I'm missing?
I just have really bad chest pain.
Yeah.
And my mum died from that.
Jessica went home after Dr. Meyer treated her and referred her to a gynecologist. She's now seeing an endometriosis specialist and is feeling much better. Father of 3 Ahmed suffered horrific injuries when his leg was crushed in the cabin of his truck. With the bones shattered into many pieces, Dr. George feared he might lose his leg.
Essentially amputated.
I feel the most luckiest person in the world to have my leg stitched back to the foot.
Ahmed spent 40 days in hospital and had multiple operations.
When I wake up from the shock, my first thought was for my wife and my kids. When I saw them, they start hugging me and make me cry. And I tried not to cry in front of them, to not let them feel how serious my injury was. But I was so happy, so I cried from the happy. A very positive person, and I would like to walk again and go to work and be around the people again.
Ahmed needs more surgery and faces a long rehabilitation. But with the help of his family, he's intent on getting there.
I'm very lucky to be alive.
Last week, I just fainted.
You fainted?
Yeah, got on the bed and didn't move till Wednesday.
Former bar manager Kevin fell at home and hobbled into emergency a week later with leg pain. But Dr. Michael was more worried about his dizzy spell.
The top part of the heart talks to the bottom part of the heart. And I think the time you passed out, there was a disconnect and your heart wasn't talking to itself.
Oh, I had an argument.
I had an argument, exactly, yeah.
Kevin did have a broken leg, but now he's back up and about.
You doing, Rusty?
Kevin, it's good to see you.
Yeah, in a long time no see.
How are you?
And he's finally able to have that beer with Rusty.
Good to see you, mate.
Cheers.
Cheers.
Kevin's cardiologist is monitoring his condition and still weighing up whether he'll need a pacemaker. But Kevin's made some lifestyle changes.
Now I'm getting home help. Before I had to walk to do the shopping and that was a bit of a bother.
He's not quite ready for a pub crawl yet, but is enjoying catching up with mates.
The one thing about nurses, they've got a bloody good sense of humour.
They do. Well, yeah, that's right. They've got to put up with people like you.
Oh,
Good to have you back.
what about in the front? It's nice to be back. You might as well enjoy yourself while you're alive anyway, because as the old saying goes, you're a long time dead.